Welcome to the TMI podcast. We're in the studio today. We have a really great show. Dr. Corey is here with us. We're going to be talking about the opioid epidemic, and a bunch of different things. We have Jen here too. So let's start the show. Welcome to TMI, a podcast by Henry Ford Allegiance Health. Welcome back to the studio. It's been a little while since you've been here. What is our topic today, Jen?
Today we're going to be talking about the opioid crisis that is affecting our nation, and I think we've got a lot of really good questions, and just hopefully it will open up some conversation to kind of figure out what's going on and what can we do to make a difference.
Yep, and living here in Jackson, Michigan, we see a lot of these kind of issues, and I'm not sure if it's more than other communities around the country, but it definitely feels like it's becoming a real issue.
Right. Yep. It's very prominent here.
And I think it's really neat that our health system is kind of taking steps to be responsible and make sure that our community is moving in the right direction.
Yep.
So that's why we brought in kind of a leader in the topic, especially around here.
Yeah.
Dr. Corey, welcome to the podcast.
Thank you for having me.
Yeah. Now, you've been involved in this kind of talking on these topics and thinking about these ideas for a while. What is your background and kind of what do you do in the health system?
So I am an emergency physician by training. I joined a health system here with our independent group back in 2008 as the vice chair of the emergency department. And one of the things I started noticing probably in about 2005, 2006 was an uptick in patients who were just coming into emergency departments asking for medications. And they would call ahead to see who's there because they knew who would give them medications and who wouldn't. Oh. And it was no different here. And it was actually significantly worse, I would actually say. The process was no different, but the amount was much, much higher than what I was used to.
Right.
And so looking at the resources we had, we started tracking this and started developing guidelines. And this is back, 10, 11 years ago. And just kind of took off from there, working with our behavioral health department. And now, 10, 11 years later, work with the Hospital Association, work within Henry Ford Health System, work at the state level, national level. And I'm here as an expert. I would never have guessed that 10, 11 years ago.
Wow.
Well, we're glad you're here because we have a lot of questions.
Yeah.
Hopefully I can help. But I mean, at the base of this is just common sense answer.
Sure.
Yeah. So we hear a lot about this in the news and from people that I know. Why is this actually a crisis or an epidemic, though?
Well, the uptick in use and abuse inappropriately has gone up significantly since the push for more pain control. And you're looking at maybe 2012, 41 deaths a day to now over 115 deaths a day from an opiate overdose. And that would include synthetic opiates, prescription pills, and heroin, and whatever's mixed in with the heroin. And that's probably a underreported number because in some communities when they do autopsies and it's multi-drugs, they might not say it's heroin and they'll say it's multi-drugs. But that in and of itself, think about going from 25 years ago to 10 deaths, 12 deaths a day to now well over 100. That's a very significant number.
That really is. So what's the difference between an opiate and an opioid?
So opiates are naturally occurring substances. So they come from the poppy seed and the opium plant, right? So morphine is a naturally occurring substance. That's an opiate. Codeine is an opiate. Opioids are actually synthetic opiates. And that's really the difference between the two. And why is it called more of an opioid crisis? OxyContin was the first medication that pushed it. That's synthetic. And then when you start seeing a rise in deaths from heroin, it's typically heroin that's laced with a synthetic opioid, particularly fentanyl and carfentanil and some other ones.
Gotcha.
But in layman's terms, it's really interchangeable. And what we're dealing with, it's one and the same.
Right.
Wow. So what are some of the components that make this such an issue? Like, how did this get started? Like, was it, I hear some people say it started because of overprescription or an influx of drugs on the streets or things like that. What kind of are the factors that brought this about?
Well, you can't blame any one thing. So it's really multifactorial, and it happened over probably a good 25 plus years. So we go back to the 90s. There were drug trials done and publications that said medications like OxyContin could be given for chronic pain safely with addiction rates or dependence rates of less than 1%. And these were published, but these were trials done by pharmaceutical companies, and it's come out since then that they were really not accurate. Actually, the pharmaceutical company actually knew that that was not actually correct and did it anyways. Profits soared. I mean, you had stories of pharmaceutical reps who were pushing these medications, making absurd amounts of money. Now, the doctors, in essence, were told, one, this is safe for your patients.
Right.
Yeah.
Two, you have the advent of the fifth vital sign, which is pain as a vital sign. I'm sorry, I do not like that concept. Pain is a symptom, and it's important to have pain because it tells you something is wrong. What we're not talking about is I have pain that's really high and not controllable, but you need to have a little bit of pain to heal. If you have no pain, and you have, let's say, a broken ankle, but zero pain, you're going to walk on it. It's not going to heal. That's really basic example, and that's how I like people to think about it. So it's okay to have a little bit of pain. But with pain as a vital sign to push to get to zero, that started it. Then providers, whether physicians, nurse practitioners, PAs, dentists, vets, you go on down the list, you have this pressure from the federal payers that say you need to take care of their pain, right? And the patient had a right to say if my pain was managed or not. And then you add in reimbursement because of HCAPS, a patient experience. Now, we're learning more and more. Was that necessarily bad? Probably not the right time to start it, but you were paid for basically doing this. And so when there's a lot of money tied to it, providers felt that they had to give more medication. And unfortunately, that became the trend. So we trained a lot of people who just trained like that. And it became convenient for them as well, because if you don't think there's an addiction issue, why not give them a refill over the phone? Why not write for 2 months so they don't come back and they just take it as they need to? So that's a start there. And then we had a society that social media, you add in social media, you add in the internet, the advent of the internet at the same time, and people now post whether or not they liked someone on media, and people read it. So that could damage your business. So there are a lot. It was really multifactorial.
Wow. So who's going to be at the highest risk for becoming addicted? I know I recently got my wisdom teeth out, and my dad made a comment that, hey, I saw something in the news that, people tend to, that's kind of like the way that they start to become addicted is after a dental procedure or something. Is that the case, or where do you see that increase?
Well, I'd like to, so there's a difference between dependence and addiction.
Okay.
So if you, the likelihood that if you get a prescription for 7 to 10 days of an opiate, there's a 20% chance that you will still be using an opiate a year from now. That is not necessarily addiction. That is dependence on the medication. To give you an example, if you have high blood pressure and you stop taking you have a dependence on the blood pressure medication. Same concept. Addiction is more of an aberrant behavior. So somebody who would potentially commit a crime to get access to the medication. So you would be getting it from a not reliable source. So you're not getting it from a physician.
Okay.
You're getting it off the street. You might be stealing to access money. And that's really the risk piece, right? And there are tools out there that can tell you who's at higher risk. And typically speaking, anybody between the age of 16 to 45, past medical history of prescription abuse, illicit drug abuse, or alcohol abuse, plus family history with that same issue, underlying mental health condition, and if you're a female, adolescent or pre-adolescent sexual abuse. And those are the big risk factors right there.
Man, this is so interesting. And so should we be trying to help people who are dependent on these drugs? I mean, is that where you kind of start to combat this, or?
Well, I would say number one is, how did we get here, and how can we turn back that dial, right? And that's what we're doing now within the health systems, the hospital association, and our state. So we put laws in place that actually will not perpetuate the problem moving forward.
Okay.
But the current situation that we have, and all these people who are dependent or in addiction on these drugs at this point in time, that's a different solution, and I think we're all struggling in how to deal with it. And it ties directly into the mental health crisis that we have in the United States as well, because it's no different.
Right.
And most of them, most of these patients have an underlying issue like that, and it would be hard not to.
Yeah, absolutely.
So I think when we try and help people, what are some of the signs that we can see? Because it's kind of a personal thing for people. What are some things that we can see? What are the best steps we can take to help someone who's dealing with this?
I think number one, I believe as a society we like to hide things. So we have to be truthful and open. And for the same problem that we struggle with, we have a higher rates of now suicide, depression, bipolar, and you name it in the mental health side, it's a taboo thing. We don't want to talk about it. We shame it. And we shame addiction. And it's a disease. It's a chronic disease. And when you're dealing with a chronic disease, if you talk about it, and it becomes okay, you can control it. It's easier to control. People are aware. You're not going to give somebody a large chocolate cake and a 2-liter of pop when they have diabetes, right? You're going to think differently, right? If you know that you're out with somebody who's a recovering alcoholic, you're not going to drink a bunch in front of them. You're just not going to do that. You're going to behave differently, and this is no different. So we need to be open. We need to be respectful, because when you are open and respectful, they don't feel shame about their disease, and they're much more open with it. So I believe one of the problems that you see are people hide it, and then you start seeing warning signs. They are not doing their normal behaviors. They have all of a sudden all new set of friends. They're not talkative. They've as a family member, you'll watch a member who's now just locked up in their room or out of the house consistently. You'll see changes in behavior, and that should cause concern. But that's typically a little farther down the line.
Yeah.
So if someone is dealing with addiction and they are interested in getting help, what are some of the resources that we've got available in our community or just in general?
Well, number one, you could always come to the emergency department. You can contact Lifeways in town. You can contact Access, which is our mental health at Henry Ford Allegiance, and we can help guide you. We have the Addiction Recovery Center, and then there are a lot of great people in this community who are doing work. There's like New Vision's Home, which is right here downtown, where you can go in and have discussion with people, and they will have people in recovery be your coach, and that's a good place. But that's really where the access issue is. I think one of the biggest problems is, okay, we get somebody in rehab, whether it's a 3-day, 7-day, 14-day, or, multi-month rehab, the moment they get back into that area where they're seeing the same people doing the same thing they were before, they're much more likely to relapse. So you have to control the environment outside after they come out.
Gotcha.
And that's one of the struggles that we have.
Sure.
Yeah. You have to completely change things, how you live. Well, I did hear some stuff about the use of Narcan to help people if they're
overdosing.
Yeah. What is that? And how, I've heard mixed things about that.
Well, it's so Narcan is a medication that we've been using for years to reverse accidental overdoses or real overdoses, purposeful overdoses in opiates and opioids for as long as I've been practicing and even beforehand. But now with what's going on, the mix is to actually put it out in the community. So you have first responders like police officers, and then our paramedics and our EMS colleagues who are using them, our firefighters are using them, and it's saving lives. And they save lives. I mean, that's what it does. It saves lives. But you need more and more when you're using a synthetic medication like fentanyl or carfentanil. You need a lot more doses. But it saves lives and gives people a second chance.
And is that partly why overdoses have become so prevalent?
Actually has nothing to do with it. And interestingly enough, no statistic has ever shown that. There's a belief that if they have something that can reverse it so they won't die, then they will do it. The problem is they can't administer it themselves. Somebody else has to administer it.
Right. That's so true. I think I was talking about the synthetic opioids, fentanyl and things like that mixed in now. So it's great that we have Narcan and can help people when they desperately need it.
What with the synthetics, I don't think the intent was to actually, because people are getting Narcan, let's give them synthetic.
Oh, right.
That was it was really the intriguing piece was, and the mentality and the thought is of if you give them something that gets them higher, then they'll come back for more, and that's really the precipice for that, right? So you mix in something that gets them even higher, but that makes it, because they bind to the molecule a little more difficult. They're more difficult to release with an initial dose of Narcan, so you need significantly more.
Okay.
Wow. Okay. That I was wondering why that was used more. Do you have any other questions, Jen?
Well, I mean, I think we've covered quite a bit of it. I guess, I mean, I think that we have quite a bit that we can do as a community. I mean, you made some great points just about being open and just making sure that we're talking about this and just being honest about, and letting someone share their story. If they're struggling, then, I mean, is that kind of what you're meaning? Like so if I have a friend who's mentioning things that kind of make me a little bit nervous, just let them talk, let them get it out and possibly refer them to someone who might be able to help a little bit further.
I agree with that 100%. To me, it's not just struggles with addiction in that. It could be any disease. And the fact that we treat it differently, I think, is our biggest problem. And I would call addiction a chronic disease, and it's a lifelong struggle. As we know, alcoholism is a chronic disease. It's no different. I mean, the concept, it's still addiction to substance. So that's why it's a risk factor. So it's a chronic disease, and we have to treat it as such. Hypertension is a chronic disease. Diabetes is a chronic disease. Coronary artery disease, a chronic disease. These are all chronic diseases, and it's okay to talk about them. And we have to not in a way shame it, right?
Sure.
Like we do with other mental health issues and brain-related diseases. So the more we talk about things, I think, is the first step in the right direction. And there are tremendous resources in this community compared to other communities this size. I think the people of Jackson are very lucky. And this health system has done a tremendous amount. And Henry Ford as a health system is also taking the lead at the state level, and they're doing a great job.
That's amazing.
Yeah.
And it's a different way of thinking about it. I mean, I'm just like you, like where I would just kind of assume like you just don't talk about it. It's a bad thing, and we shame people, and it's absolutely something that needs to change. And I think this was pretty eye-opening today to just get a different perspective. So
yeah,
I've met a lot of people who have suffered of this disease, and I've known some that were dear to me that have passed away, and from this disease. And what I find very interesting is, people want to talk about and say, look, they're going out and getting high. Once they get to a certain point, they're really just trying to get by because they don't want to go through withdrawal. And I think that's really lost on people, because the majority of them, once they are really deep into this disease and really, really sick, they're just trying not to go through withdrawal and trying to get by. And interestingly, most of the overdoses, and a lot of overdoses happen when somebody comes out of recovery, and they haven't used in a while, so their tolerance goes down. And when they use, they think they can take what they took before, and that's when the problems of overdose happens.
I have seen that.
Yep.
Well, thank you for being with us today. And we are so grateful for the things you're doing in our community and leading this conversation and discussion on a national level, and really bringing some wisdom to a topic that really needs to be talked about more. So
Well, thank you for having me. And I think the goal is to do what's best for our patients and our community.
Absolutely.
Great. And if you would like to hear more topics like this, you can subscribe to our podcast in iTunes. If you have ideas for topics you would like us to talk about, feel free to connect with us on Facebook, and we'll talk with you next time.
Thanks a lot.